So a regular cleaning is someone who has pink, firm, tight, healthy gum tissue, healthy bone levels, no inflammation and bleeding. We are pretty much staying super gingival. So above the gum line, cleaning, polishing floss, x-rays, update medical history. We have to do a deep cleaning or scaling and root planing on someone when they have periodontal disease, they have inflammation of the tissue, there's calculus buildup under the gum line that's causing inflammation and causing that bone level to kind of drop, which in the long run can lead to loss of teeth or mobile teeth. I've seen patients who haven't been to the dentist in 10 years and they have very healthy gum tissue. I have patients that it's been a year since they've been and they now need, another deep cleaning or need to start that process from the beginning. So it's not one size fits all.